Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. Tonight we are talking about heart attacks. ExpressCare's Dr. Jitka Lom is here with us in studio telling us everything about the symptoms, what to do when you have it. But now we want to talk a little bit about prevention. Prevention is always key. So what can people do starting now, no matter what age they are, to start preventing? And we were talking before the break about smoking, so that's probably one of the first things.
Yeah, quit smoking. So there's the risk factors that you can't do anything about. That's your family history, or if you're a male. Then the rest of them you can do something about. You can quit smoking, you can control your diabetes, you can control your cholesterol, and your, did I say high blood pressure? You can control your high blood pressure. So there's 2 that you can't do anything about and 4 that you can do something about. So please take care of those things. It means taking your medicine. Sometimes people are reluctant to do that. Understand that these are life-saving medicines. They will help you to be healthy. The other thing is that when you exercise, okay, now with caution, okay, hopefully you began your exercise way back when you were a kid and continue throughout your life. But even if you're restarting now, you want to start gradually but consistently, because as you exercise, your heart muscle gets better at using oxygen, and even some new little blood vessels grow in there so it can supply the heart muscle better, so you have more reserve. Whereas if you're sitting around all the time plugging up your blood vessels, they really haven't had much of a chance. So exercise is really important in moderation.
Okay, and then what else as far as eating? You mentioned cholesterol, and I think unfortunately with all the delicious food that Guam has, the coconut milk and the all the barbecues and stuff like that, it's hard to maybe keep cholesterol down, but it does play a huge factor.
It is a risk factor as far as cholesterol. Knowing that much of the cholesterol is internal from what your own body produces. Of course, if you eat a lot of greasy stuff and in particular meat, your cholesterol will go up, so you should eat a lot of fiber and vegetables. But if your cholesterol is up, really consider taking the medicine, because dietary change is hard. You should do it. Please do it also. But consider taking the medicine to help yourself a little bit more. And one other thing that's related to food is your oral health. To help your heart, clean your mouth, okay? Please go to the dentist, get a checkup, get a cleaning, because when your mouth is clean, you have a much lower risk of having a heart attack. I think that the number is something like 4 times lower if you have good oral hygiene. So please take care of that as part of your heart health.
Good to know. All right, now taming your stress. Stress has a lot to do with.
It does. Monday morning is when the time of the week where the most heart attacks occur, because people are stressed out on their way to work and maybe got really angry before. Anger, very, very, very toxic to our body in so many ways. Resentment, very toxic to our body. And generally stress. Now we have good stress, that might be like getting married and winning the lottery, but then there's all the bad stresses that occur with finances and grieving and so on. So be aware when you're under stress, your heart is under stress too. So do whatever you need to do, including get a checkup or take your medicine or think better thoughts. Forgive other people if they're upsetting you. Forgive yourself if you haven't, if there's something you feel like you need to do, forgive yourself for. And try to just take some of the pressure off yourself, and your heart will thank you.
Okay. And sleeping. How important is sleep for your heart?
Sleep is super important, and so many people that are chubby on Guam have sleep apnea. They're not getting good rest during the night. They're waking up many times and snoring. Snoring independently is a heart risk. So is sitting, okay? Just by sitting for 8 hours a day, you actually increase your risk of a heart attack. And stroke. Actually, it's almost equivalent to one of the other risk factors like high blood pressure, just sitting. So you need to get up and move around, and that will help.
Okay. Any last tips that you'd like to leave with our viewers? I did want to ask this before we throw to break was, do you recommend people taking aspirin every day?
Yeah, on Guam, it's a bit of a tricky situation where if you are Pacific Islander and you have high blood pressure, you should really talk to your doctor first, because in some cases the aspirin seems to actually increase your risk of stroke. For most people, if you're trying to prevent heart attack only and your blood pressure is under good control, a baby aspirin every day or even every other day is going to be very beneficial to you. So in general, the answer is yes.
Okay, Doc, thanks so much for coming in. We always do appreciate it. Dr. Lom will be back again next week. We will be back to wrap up the show right after this. Stay with us.